Hi, I'm Donna Dowell, board-certified family nurse practitioner and part of a growing number of healthcare professionals in New Mexico in support of the New Mexico Health Security Plan, a plan that will ensure comprehensive, quality healthcare coverage for New Mexicans. Healthcare under our current system is challenging for many. This short video is part of a series that features the personal healthcare stories of real New Mexicans, stories you will recognize as all too common.
Hello, everyone, and thank you for taking the time to listen to my story. My name is Davena, and I am a pharmacist who lives in Las Cruces, New Mexico, and works at a hospital and primary care clinic. When I was in college, my mom, at a young age, was diagnosed with Parkinson's disease. Because of this pre-existing condition, she was unable to get health insurance. So she and my dad paid for her medical bills, her neurology appointments, and her medications out of pocket. Living on a modest wage from working on a ranch and then as an independent contractor, the cost of this no doubt contributed to the already stressful situation of living with Parkinson's disease. Fast forward to Thanksgiving 2018. I was working in our inpatient pharmacy when I received a call that my dad had had a massive heart attack. It turns out he had been having chest pain for a few days prior, but it finally got bad enough that he decided to go to the hospital in Silver City. Shortly after arriving to the emergency department, he went into cardiac arrest. Thanks to the amazing team at Gila Regional, my father was resuscitated. And when he was fully awake. And when they told him that he would have to fly in a helicopter to Las Cruces to a cardiac cath lab, he initially refused. You see, he didn't know how he would be able to pay for that helicopter ride. Even in this life or death situation, he was forced with that decision because he didn't want his family, his daughters, to be faced with those medical bills. At that moment in time, my dad was stuck in a crack in our complex and fragmented healthcare system. You see, as an independent contractor, he didn't have employer-based insurance, and to purchase insurance on the health exchange was too expensive. He was a veteran and had enrolled in the VA, but hadn't been seen there for a few years because he hadn't needed to. He had just turned 65, but he didn't know the status of his Medicare. Fortunately, a nurse at the emergency room convinced my dad to get in the helicopter. And he made it to Las Cruces and received excellent care and is fortunately still alive today. However, for nearly 2 years, my dad dealt with the stress of receiving medical bills from the different entities and fighting with the VA to cover his care, which they ultimately denied. My parents' stories and the countless others of the people that I have the honor to work with as a healthcare professional are what motivate me to create a better system. You see, it doesn't have to be this way. Think about this. We live in the wealthiest country in the world. Every American should be able to go get medical care when they are sick without fear of financial ruin. Thanks to the Affordable Care Act, millions more Americans now have coverage, and insurance companies can no longer deny coverage based on pre-existing conditions. However, there are still millions that don't have coverage, including over 1 in 10 New Mexican under the age of 65. And even those with insurance are too often struggle to afford their premiums, deductibles, and co-payments. As a pharmacist, I feel it necessary to mention a few other problems with our healthcare system. Number one, Healthcare providers spend way too much time dealing with the administrative burden and the complexity of our system. Just as one example, as a pharmacist who works on an inpatient family medicine team, one of my roles is to assist with discharge planning to ensure that patients can receive their medications when they're discharged from the hospital. Just the other day, we had a gentleman who had a blood clot in his leg, and he needed an anticoagulant or blood thinner to treat this condition. Our team appropriately selected a medication that's recommended first line by the clinical practice guidelines. And to be proactive, we called the pharmacy before he left the hospital to make sure that it would be covered. Turns out it did require a prior authorization. So we took the time to submit the prior authorization with the necessary documentation. And knowing that it can take up to 72 hours to review a prior authorization, we provided the patient with a couple days supply of medicine so that he could go home and not stay in the hospital unnecessarily. Well, the next day we find out that the prior auth was denied because the insurance preferred another medicine in that same class. So we transmitted that medicine, learned that it also required a prior authorization, which we submitted. And finally, about 3 days later, we got the patient the medication that he needed. Collectively, my team probably spent 2.5 to 3 hours on this one case. Number two, the cost of pharmaceutical drugs in the United States is outrageous. Do you know that US drug prices are 4 times the average of other comparable countries? Or do you know that 1 in 4 Americans report that they are worried they cannot afford the cost of their prescription drugs? As a pharmacist, I have personally seen what people will do to help with that. They reduce their doses, they space them out to make their medication last longer. And while millions are struggling to afford the cost of their medications, we all know that the CEOs of pharmaceutical companies are making somewhere in the order of tens of millions of dollars each year. We must address the cost of prescription drugs. And we must also transform our system to one that focuses on prevention so that we can begin to reverse the trend of chronic diseases and reduce the number of people who need prescription drugs. I believe that we can create a much better system. I believe that all New Mexicans should be able to see a doctor or other healthcare provider when they need to. I believe that all New Mexicans should have comprehensive benefits. See the doctor or provider that they choose and not be confined to networks. I believe that we must address the escalating cost of healthcare because it is unsustainable, including the cost of prescription drugs, by implementing things such as the bulk purchasing of pharmaceuticals. I also believe that we can create a system ran by New Mexicans where the money that we spend on healthcare stays within our state, allowing us to reinvest in our infrastructure. For these reasons and many more, I strongly support the New Mexico Health Security Plan. If you haven't done so already, I encourage you to go to newmexicohealthsecurity.org and learn more about it. And then talk to your legislator and ask her or him to support the next phase of the development of the New Mexico Health Security Plan. I thank you kindly for taking the time to listen to me today, and I wish you all well. Take care.
The New Mexico Health Security Plan ensures comprehensive, quality healthcare coverage for New Mexicans, regardless of income, health status, or employment. Provides choice of providers and hospitals, coverage extending across state lines without network restrictions. How can you help? Become informed at newmexicohealthsecurity.org. Sign up for campaign alerts or donate to the campaign. Contact your New Mexico state representatives at nmlegis.gov. That's nmlegis.gov. Tell them to vote for the New Mexico Health Security Plan. Tell your own healthcare story at newmexicohealthstories.com. Contact us at nmhealthstories@gmail.com. Spread the word. Forward this to your New Mexico family, friends, colleagues, and neighbors. And thank you so very much.